Good evening, folks, and happy Wednesday. For those of you joining me for the first time, welcome. My name is Cosi Belloso, and I'm a physical therapist in not so chilly anymore, Tampa, Florida. I've been a PT now for a little over 23 years, and my passion is working with the amputee and limb loss community. Now, tonight's headliner question is a response to a reel that I created last week. It's interesting. So, guys, pull up a chair. Tell me who you are, where you're from, and what is in your mug this evening as we get started with Cosi Talks Live. All right, guys, let's start off by saying good evening to the folks who have been jumping on board. We got a nice crew here. We got Scott coming in from West Virginia with his cold water, Emily from Central PA with hazelnut iced latte with cold foam. Always the best drinks with Emily right there. Cindy coming in from Warm ENC with Starry Zero in her cup. We got Crystal coming in. Oh, it's Tina Lou. Tina Lou, thank you so much for joining in. She's coming in from Fort Worth, Texas, sipping on some strawberry water. Donna coming in from Wyoming with her iced coffee. Donna, don't forget to ask your doctor that question I told you to ask him. We got Pop 19 coming in from New York with his water. We got Richard hoping this is the correct way. Yes, whatever that means. Yes. We got Mary Ann coming in from South Dakota. 70 degrees over there and totally beautiful, drinking my ice water. Enjoy that gorgeous weather. It must be beautiful in the Dakotas. It must be absolutely beautiful when you have that kind of weather. We got Kelly coming in from Michigan, Jerry Ann from Tennessee with her drink of choice is vanilla hazelnut coffee. Benny coming in from Texas. There's my Marine. Hoorah. We'll be in Fort Myers on March 25th with a pickleball, golf, and core softball. Man, Benny, you do not let the grass grow underneath your feet. You do not. You are so active. Mark saying, sorry for being tardy. Mark, you're not tardy. The rest of us are just early. Coming in from Colorado with water in his cup. Hey there, Rex. How's it going? Pastor Dave is in the house. We got a party going on. Sherry coming in from Orlando. Got my Floridians on board today. We got Linda, Richard as well from Texas, Glenn from PA. Glenn, I'm going to have a question just for you this evening, so I need you to stick around, just pouring water in your mug. Well, hopefully at least it's an interesting mug, Glenn. Hopefully it's an interesting mug. All right, we got Stacy. That's my other OI girl coming in. Stacy, I want you to stick around because I'm going to want your input as well. We have some Oprah-specific questions this evening. Hey, Teresa coming in from Albuquerque. Teresa, thank you very much for giving your support group a shout-out for Cosi Talks. Very much appreciate it. No! Is it Van Gregory's birthday today? Well, in that case, I hope he's not on here because I hope he's out celebrating. But if he sneaks into this chat, we're going to have to put him on the spot and embarrass him just a little bit. We got Jim from Ohio. Oh, hey there, Jim, coming with his new Cosi Talks mug with decaf coffee. Cheers to you, Jim. Cheers to you. Sharon coming in from Iowa. I'm going a little too fast here. I got to slow the roll down a little bit. Mary, there's my other Florida girl right there. I got my whole Integrum crew here. This is great, guys, because I sent out a text message. Those of you who are signed onto my texting service, if you know, you know, you received a message from me yesterday. I was kind of having a nerd moment, and I was just kind of reading up on certain things, and I came across the Bonded Matrix Integrum video, and I love it. And we've got some follow-up questions from that video, but let's get to the headliner question. Hey there, Bill. Bill's in there with water in his jug. So guys, if you're on Facebook and Instagram and you're following me there, I posted a reel, I think it was like last Friday or something like that. It's one of my favorite movies. Like, I am a Zorro-phile. I love Zorro. Any incarnation of Zorro, I love it. I have books. I even have a comic book. My dad and I, huge fans. Huge, or my dad was a huge fan. Huge fan, right? I grew up watching Zorro, the syndicated TV series, the black and white version, the one that was in the 90s, created in the 90s. So when the movie came out with Antonio Banderas, you knew that I was going to be sitting front row, and Catherine Zeta-Jones, like one of the most gorgeous actresses in Hollywood. Anyways, love this movie. And my favorite scene is the one that I posted in that reel. That scene, no matter how many times I watch it, I'm cracking up. Okay. How many of you saw that? How many of you saw that scene? How many of you saw that reel that I'm referring to right now? Tell me in the comment section. Let's see. Rex says, I want a Cosi Talks t-shirt and a mug. Crystal's saying, how do I get a Cosi Talks shirt and a mug? All right. So guys, these mugs, these are my new mugs. And let me put it up to the camera so you guys can see it. My daughter called it the Christian Louboutin mug. If you know, you know, right? It is my new mug. It is laser etched. It's beautiful. It's really beautiful. So this will be going on sale very soon. I am just trying to find the best way for shipping, because shipping is like a nightmare. It's a nightmare cost. So I'm trying to keep the cost down low. So I'm trying to figure out under which platform, right? And then the Cosi Talk shirts, they might be coming. I haven't had them yet, but I think I may have found a way to get them in the best way I can. Okay. So you saw the reel. Emily saw the reel. Hey there, Heartfulness in Charlottesville. Lisa saw it. Oh, and my t-shirt. Sherry. Oh, yeah. So Marianne saw it. Okay. So it's this great scene, right? So Antonio Banderas plays the young Zorro, right? And Anthony Hopkins plays the distinguished Zorro Sr. And he is training this ridiculous creature, Antonio Banderas. And Antonio Banderas is there swashbuckling with his sword, going crazy, going, I'm going to go get you. I'm going to get you. I'm going to get you. And Anthony Hopkins is just kind of watching him with disdain. And with one little flick of his sword, he instantly knocks the sword out of Antonio Banderas' hand. It is a hysterical scene. I love it, love it, love it, love it. So I finally got a chance to use it in a reel. And in the reel, I say, well, this is when clinicians tell me, okay, and I put clinicians in quotation marks, when clinicians tell me that physical therapy is not necessary for someone after amputation, right? Now, guys, those of you who've been watching me for a long time, you know that on like my top 10 pet peeves, soapbox, whatever, it's people who say that physical therapy is not necessary for someone after amputation. Or I hear, yeah, it'd be nice. I hear that a lot. Or, I mean, yeah, you could kind of just teach them some strengthening exercises and how to use the walker. Like, guys, after over 23 years of being a licensed therapist, I've heard every variation of that. And a lot of times, the majority of the times, it's coming from other clinicians. I find that I'm having to educate other clinicians on the role of physical therapy in amputee care more so than amputees, right? Amputees who have no healthcare formalized training or anything like that, they understand why they need physical therapy, okay? The clinicians are the ones I'm having to fight, right? Jane's like, to the gallows with all of them. if we're riding on that Zorro train right now. So, and again, and on a side note, you know, I inevitably I'll post a reel like that every once in a while. And sometimes it kind of is to provoke a reaction, because I want to stimulate conversation about this. And, you know, when I was building my practice and I would go visit different prosthetist clinics, this is the question I had to fight the most. Oh yeah, guys, maybe it'd be nice for you to give them some strengthening exercises. I'm like, dude, I am not a personal trainer. Right? How many of you have encountered, oh wait, is Van Gregory on board? Hang on. Van Gregory's in the house. Hey, happy birthday, man. I am not going to sing happy birthday to you just because my voice stinks. I do not have a singing voice, so I'm not going to torture you on your birthday, Van Gregory. But I am sending you lots of hugs and kisses. And happy birthday to Van Gregory. Happy birthday to the best grasshopper ever. He understands that joke. Guys, we got to all wish him happy birthday in that comment section. Man, they outed you, Van Gregory. Someone sang like a canary and told me it was your birthday today. And I told them I didn't want to see you on the show because I wanted to see you out there celebrating your birthday. But now that you're on the show, I'm very glad that you're here. Yeah. John C. Yes. Whatnot is actually, I love that platform. And I'm actually thinking of using that platform for selling the Cosi Talks stuff because their shipping is incredibly reasonable. So that's actually one of my front runners there for doing it. Plus it's like live auction. So it's kind of fun. It's a lot of fun. Okay. So let's see, what are we saying? It's usually insurance that doesn't see the need for PT. You're right. And that has, I think, Emily, a lot of that has, it's a twofold thing. Okay. Number one, there's not enough of us in the field that specialize in amputee care. There's not. It is, we are, and I'm holding my own colleague, my own profession accountable for this. We are not doing our job in serving the amputee community enough. We're not. And it is a failure on the part of the physical therapy as a profession, especially when you consider that our profession began in World War II. We were created as physician extenders to treat amputee and burn patients from World War I. That's how my profession began. Okay. So the fact that we are, and there's a mighty group, guys, there is a mighty group, small but mighty group behind the scenes that is working furiously, okay, to get the specialty of amputee care recognized within my profession. But as of right now, we do not have a formalized certification for this. Okay. And I greatly admire my colleagues who are really taking that charge on, because this is a years-long process. Okay. But first of all, yeah, there's not enough of us in the profession who specialize in amputee care. I don't understand why, because for me, I'm like, we have neurological specialists, we have cardiac specialists, pediatric specialists, we have specialists and some of the most amazing brains in my profession, right? And then those of us that do specialize in amputee care, like I said, the group of colleagues that I kind of consider myself a part of in amputee specialty world, these are brilliant individuals. Their knowledge of biomechanics, their knowledge of the human body, the knowledge of gait analysis and strategy and training, and their knowledge of prosthetics is unbelievable, okay? So that's part of it, okay? The other part, yes, insurance, right? And that's physical therapy as a whole. The loops that we have to jump through to get our services justified with Medicare and other private insurance, it's ridiculous. It's ridiculous and it's absurd. And you guys have heard me rail against that. And that is the biggest reason why I decided to not work with insurance when I opened up my own private practice. Okay. But there's also a part of me that I put the responsibility on the shoulders of the other clinicians. And we're not going to name particulars, but y'all probably know the other clinicians I'm talking about. And it's not all of them, guys. Let me say that disclaimer. Okay. 9 out of 10 clinicians. And when I mean clinicians, I am talking about the prosthetists. Okay. They do understand what it is that physical therapists do. Okay. And a lot of times, the prosthetists that understand what a physical therapist does and what we bring to the table, okay, unfortunately, they're usually saying, we cannot get anyone to work with us. And that breaks my heart to hear that, because I'm just like, I wish you lived in my zip code. And I've had some of those prosthetists send me their patients into Florida to come see me. That has happened. Okay. So here's probably what can sum it up in a nutshell. Okay. I will talk to people about, physical therapy and the need for physical therapy. Okay. They have this misconception in their head that it's just about strengthening and teaching someone how to use a walker without falling down. Right. So usually my way of asking them is, if someone has an ACL repair, they've torn the ACL. Let's talk about your typical football player on the field, right? They tear their ACL. I'm going to pose you this question as the general public. Would you say that person is going to be receiving physical therapy? Let me hear it in the comment section. Lisa saying, thank you, Dr. Weiss and Steve Pompilio, you're the best. Yeah. And guys, when you do find a dynamic duo like Dr. Weiss and Steve Pompilio over at Brooks Rehab in Jacksonville, Florida, that have dedicated their profession and their professional lives to serving amputees, man, you will not find a more loyal bunch. Josh says a few of them are retiring in Cleveland area and nobody wants them to go. Yeah. Michael says, it's Mike PTA. In California. Okay, guys, we got a physical therapist here on board. So we're going to welcome this guy with open arms. Yeah. So you guys are saying, yes, of course, if a person has an ACL repair, and it's a lengthy process, guys, the rehab process for an ACL tear, 9 months up to a year. And if the person's an athlete, yeah, even more so, right? No questions there. If someone tears their rotator cuff and has that rotator cuff surgery, which is kind of intense and kind of painful, what do you think a prosthetist does after he gives them some kind of a bracing? He probably asks them, what? Are you going to physical therapy? When someone has a total hip replacement or a total knee replacement, does anybody think twice about the physical therapist walking in the room and seeing the patient from the minute they wake up from surgery all the way until they're done recovering and walking on their own again? No. Someone has an entire limb removed from their body, and your girl here is getting almost into fisticuffs trying to justify why her treatment services are mandatory. Think about that. And I've used that line, guys, all the time. It got to a point where I just got tired of trying to explain it the professional way. Like, we got to rehabilitate those muscles. We got to reestablish a sense of proprioception. We have to prevent gait deviations down the line. Forget about all that. I just look at the prosthetist and I say, what do you do with your ACL patients, your rotator cuff patients, your patients who have foot drop and need an AFO brace? You send them to physical therapy. So why is it that when someone has their limb violently removed from their body, do you think that you just put a prosthesis, a fake leg on them, and they're just going to get up and walk out of your office? Yeah. Needless to say, the older I get a little more blunt about things, right? Right? Teen Lou says, I had to have PT before they would repair my ACL and then much more after surgery. Boom. She's right. Guys, when I was a high school student, long time ago, and I was doing all my volunteer hours to prepare myself for physical therapy school, I did over 500 hours volunteering in clinics and in hospital settings. Do you know how many patients were coming in pre-surgery to get therapy done? Right? This is where you see my Latina blood coming through and me just going, right? And guys, I'm having to constantly, and you guys can see the comments, like whenever I post something like this, every once in a while, I feel a little sassy and I throw a reel up there saying something about that. There's always people, and the people who are trying to justify that it's not really necessary, they're always clinicians. They're always clinicians. Okay? Here's another thing that I get. Happy birthday, Van. Man, I hope you're seeing all this birthday love you're getting in here. He is a seriously cool guy, man. If you guys have not met Van Gregory, he is a seriously cool dude. Very seriously cool dude. Okay? David says, yeah, there should be. I had to do that. Football guy here. I know, right? Okay? So, and I'm trying to get my thoughts straight because I have so much to say about this. Okay? Here's something else that I hear a lot about. And I hear this, and this is sometimes what I'll hear also from some folks on Facebook, that they'll say, well, I just put my leg on and I walked. I was fine. My patient figured out how to walk. I had them walk up and down in the parallel bars. We worked with him in the clinic and they walked fine. Guys, in the 23 years I've been practicing, I can count the number of times on one hand that I have seen someone put on a leg and go up and down a few times in the bars and they walked normally in 23 years. Do you know how many patients I've seen in 23 years? Okay, I'm going to tell you who those people were. They were young. They were below the knee amputees. Okay, and they looked a lot like this. Very fit, athletic background of some kind, and they had a nice long limb for amputation. Okay. For the people that I don't see, without even looking at them, when I hear someone say, well, my patient just put their leg on, they practiced a little bit for the couple of visits they came to see me to work on their leg, and then they were fine. They figured it out. Number one, they're going to be presenting with gait deviations. I can guarantee you. They will be presenting with gait deviations. Okay. Number two, they are not going to be walking to their maximum efficiency. Well, but they're still walking around from point A to point B. Why do we care about them walking to their maximum efficiency? First of all, chronic overuse injuries. Okay. When you start walking with an inefficient gait, first of all, you're going to be exhausted by the end of your day and you're not going to be able to complete your activities the way you used to. Maybe if you're really young, you can overcome that. But over the course of time, your body is going to start producing compensations. And those compensations are going to lead to chronic overuse injuries, including having to get joint replacement surgery or tearing something like an ACL. Well, and then you'll get your physical therapy. Okay. Let me tell you another great example, because this is the example that probably I get a lot too. So this handsome young man right here, his name's Damon. Okay. Damon, if you guys have my book, if you have my videos, you know that Damon is my male below the knee model in my program, right? So when Damon, and he's been on the show, he's told a story before. Damon is retired military. He jumped out of perfectly good airplanes for a living, right? Did fine with that. Unfortunately, had a motorcycle accident that took his leg. Okay. And he was given the leg by the prosthetist. He put the leg on and he figured it out, right? He figured it out. Years later, never did physical therapy, obviously kept up with his fitness. He would go to the gym, do his push-ups, do his sit-ups, good fit guy, right? Years later, when I asked him to be a model for my program here, we're talking, I'm getting his history, and I was like, you never had physical therapy? And he goes, no. And guys, to look at Damon walk up and down with pants on, you cannot tell he's an amputee. He is one of those rare unicorn cases. He's one of my 5 cases that I mentioned to you, okay? When I started working with him on the basic exercise of a quad set, okay, those of you who have my book, the quad set is the very first exercise of phase 1, okay? Very first exercise of phase 1, right here. This is the exercise that when my patients come out of the OR in the recovery room, I am doing this exercise with them. So to say that it's the most basic exercise, he was struggling with that exercise. I had him do 10 repetitions and his muscle was shaking and quaking. And I'm like, Damon, what's going on here? And it hit me. I'm like, this guy never received the rehabilitation. His motor units are not firing. So because he was young and in shape, his body had enough motor units working in those muscles to be able to walk and to do a pretty good job of walking. But then when I started talking more to Damon and asking him, what are the activities you like to do? He's like, yeah, I used to like to run in the military, but I've never been able to run after my amputation. And I just figured that was just one of the things I would have to give up. I said, why do you think you can't run? He goes, I just can't. He couldn't explain it to me. What he couldn't explain was his muscles not only were not strong enough, they weren't coordinating together. They couldn't talk together to do that high level functioning activity in a young man who was in his 30s. Are you kidding me? And he had several prosthetists along the way. None of them ever said to him, maybe you should go see a physical therapist. So this guy spent many years after his amputation not being able to perform at his maximal potential. Okay? In less than 6 months doing this program and working with him on running mechanics, he's running way faster. The last time I went running with him, I was huffing and puffing. I was well behind him, and he's running 5Ks. Okay? So the people out there saying, well, my patient was able to walk and figure it out on his own, you can tell me that till you're blue in the face, but you are shortchanging your patients. Okay? Another perfect example. Another one of those 5 cases. Young man came in to see me, and it was actually his lawyer who brought him to me. His lawyer. He had a case, and whatever the case was, how he lost his limb, he received a settlement from the lawyer. And the lawyer, who had no clinical training whatsoever, was trying to make sure that this young man was using his settlement appropriately to get the care that he needed, that he got the prosthesis that he needed, that he got the adjustment to his car, et cetera, et cetera, et cetera. So somewhere along the line, I get a call from a lawyer and I'm like, oh, geez, what did I do? They finally caught up to me, right? And he says, I've heard you work in amputee care. I'd like for you to see this gentleman. Okay, great. Rearrange the appointment. I go to the waiting room to go pick up my patient. I'm looking around. I can't see my patient. And I'm seeing this young man walking up and down in my waiting room. That was my patient, right? So he's number 2 of the 5 people I mentioned. Okay. He was wearing pants that day. You could not tell he had had an amputation. He was a below the knee young man. I tested him. I tested his strength. I tested his balance. He looked phenomenal. And I said to the lawyer, I was like, look, at this point, for learning how to walk with his prosthesis, he truly does not need me. And I can't believe I'm saying this. Again, guys, for me, I'm like, wow, this is a unicorn case. I go, what he needs right now is mental health support. What he needs right now is that support. But then when I asked the young man a little bit more and talking to him more, he goes, yeah, I used to play soccer, and I have my young son, and I'm embarrassed because I can't play soccer yet. I can't figure out how to play soccer with my son. Okay. Now, these are extreme cases. These are cases of obviously very high functioning level individuals that one could argue, do they really need the physical therapy? Yes. It's called quality of life. It's called, obviously preventing the overuse injuries and things like that, because both of those young men are going to be more vulnerable to that. But then quality of life. So let's look at the other end of the spectrum, guys. Let's look at the other end of the spectrum. Those of you who are stuck on your walkers, that are stuck on your canes. And prior to your amputations, you were walking independently. Yeah? All right, let's hit the comments, because I'm getting all fired up here. I'm getting all fired up right now. Josh says the only PTs I knew that specifically only worked with amputees for 20 years plus, and they have nobody to take their spots. It's sad. Yes, it is very sad. AJ says, my insurance said physical therapy was not medically necessary after my amputation. AJ, all I can tell you is your doctor, your surgeon should be writing a Bible to the insurance company to order and justify that, because that is baloney. Then we're going to say it that way, right? Crystal says, we need you in Texas. Girlfriend, I lived in San Antonio. I love San Antonio. I love me some San Antonio, right? Michael says, it's frustrating as therapists when all patients want to do is walk. Well, I mean, it's one of those things where we have to teach them to walk, but there's so much. And we talked a lot about this last week, guys, right? Last week's headliner question was, do you really need to do a lot of walking when you're in physical therapy treatment? And we talked very extensively, go back and watch those videos, on how 2/3 of my treatment with my patients, when I'm teaching them to use a prosthesis, takes place within the parallel bars. Right? There's a lot of the foundational gait mechanics that is involved there before you even take those steps outside the parallel bars. So much of that. And again, this is what many of our prosthetist brethren do not understand, especially if they haven't had a chance to work with an amputee specialist. Okay, guys, in the 8 years that I've had my practice here, I've had the chance to work with some phenomenal prosthetists. And I am grateful to them because they opened their clinic doors to me. And I could tell on many of them, not all of them, many of them were sitting here going, who is this chick? And do we really need this in our clinic? And then they would see me working with the patients. And it you could just see like, oh, this is what they do. This is what they do. Right? Let's see. Emily says, even if you don't end up using a prosthesis, you need physical therapy to build strength to make up for the limbs you lost. Yes. Those of you who use wheelchairs for your primary source of mobility, tell me you don't have back pain. Okay. Tell me you don't have tight hips from sitting in a wheelchair all day. Tell me that your shoulders are not feeling it. Right? Yeah. Yeah. Okay. Lisa says, 2 years out, I'm going back for some PT. I feel like it's important to stay on top of it. Yes. Guys, you go and I'll continue to say this until I am blue in the face. And I want this to happen because I want the clinicians who are listening. Perhaps there's some clinicians out there who are listening that they don't want to come in, and I'm not here to bite your head off. I know like I'm getting all riled up about it, but I want to bridge that gap. Okay. Saying that physical therapy, yeah, it'd be nice for our patients to have in a perfect world. Folks, in a perfect world, our health would be in so much better shape because we wouldn't be making our population sick with the food that we feed our standard American diet. That's my perfect world, okay? Because 60 to 80% of these amputations are happening from diabetes and vascular disease that we can trace back to the poor nutrition that we have in this country. That's another soapbox for later. But when I think about in a perfect world, okay, that's what I think about. In the real world that we live in, okay, saying that physical therapy is nice to have is the same thing as saying, it would be nice to have some anesthesia during that surgery. Or, yeah, it'd be kind of nice to have some pain medication after that surgery. Guys, it shouldn't be, it would be nice. It should be, it's going to happen. It's going to happen. Okay. Yeah. See, Stacy says, never did PT after original amputation, just walked off and figured it out. Oprah is the first time it was required and prescribed. And Stacy, again, you're one of my outliers here. You're an incredibly active, athletic woman. Okay. But having a physical therapist who could have worked with you at the beginning with the Gait foundations, now that you've worked with a physical therapist after the Oprah system, you can see the difference. Right? It's not to say you still wouldn't have used Oprah. And I think Oprah was obviously one of the best life decisions you made after amputation in that regard. But in terms of, and everything else that's going on, how did physical therapy help you so much more after Oprah versus not having it after your initial amputation? And then moving forward in your life, guys, you've heard me say it. This is for my newcomers. This is for the people who need to hear it more than once, because repetition is the mother of memory. Physical therapists should be a part of your life. Even if you have 2 anatomical legs, I have 2 physical therapists to put me back together when I do something stupid, because my body is getting older, right? And my body's been through some stuff. It's been through 4 pregnancy. It's been through chemo. It's been through a lot of major surgeries because of cancer, right? Even if I did not have any of that kind of medical history, my body is getting old, as much as I don't like to admit it, right? And we need physical therapy. That is one of those things to help us with this. And there's so many different ways that it can work for you. Okay. Hey there, Kay from Baja Sur. My winter escape place is so great to see. It's so nice to see you too, Kay. It has been very, very long since I've seen you. And I was looking at some of our videos from a little while ago. They came up in my memories today. Brought a smile. Emily says, I'm still trying to build strength 3 years later. Yeah. And guys, we've talked about this where, there's always another step you can go up. The same way that we see those Paralympians right now and those Olympians taking their fitness, taking their athletics to the next level, there's always another level that you can continue to work towards, right? Crystal says, I was not offered PT. I'm learning it from support groups, other amputees in here. Yes. And guys, I want you to take this back. You are your best advocate. You are your best advocate. And again, you don't even need to be able to explain it in medical terms. You just go to whoever the doctor is or the prosthetist is, or even the physical therapist who's telling you, do you really need physical therapy? You can give them my analogy about the ACL repair, the rotator cuff repair, and total hip replacement. If those people need physical therapy, why wouldn't an amputee need physical therapy? And just wait for them for it to dawn on them. Wait for that little light bulb to go over their head. You have my permission to use my line. Okay? Because you guys can be the best advocates, and you're also the ones who can also educate your fellow amputees who perhaps are not watching the show. Okay? So we need that. We need that support. Okay? All right, guys, we got to pay some bills. So let's kick it over to one of our sponsors. So College Park, and guys, we're going to be seeing a little bit more of College Park in the next couple of months. College Park's Odyssey IQ is the microprocessor foot that's lightweight, low profile, and smart, adapting to your every step. So many of you have been asking me about the microprocessor. What's a light one, low profile? There's your answer right there. Guys, for those of you who've been with my show, I depend on the generosity of my sponsors. So even doing something as simple as clicking a QR code on my Wednesday night shows, this shows the support for my sponsors. And this in turn also helps show support. Let me say that fast 3 times for my Cosi Talks live show. So please, I want to see you guys clicking on those QR codes and just having a look. All right. I have not talked to my Instagram people, and I do apologize. Let's say a quick hello to my Instagram people. We got Mark Edwards on board. We got Fiora on board. Ismael, thanks for joining. Let's see. Mark, that is an excellent question, and I hope you're still on board to listen. Okay. Mark says, what about PTs that have no clue how to train an amputee to ambulate? Qualified PTs are needed to assist patients to gain mobility. You are absolutely correct. Mark. And I'm not sure if you were here for the first part of the session where I'm just like, the first people I'm going to hold accountable for this misconception of physical therapists are my colleagues, my profession, because we do have a shortage of specialized physical therapists for amputee care. And you want to know what really just gets me like even more fired up? The average boo-boo bear physical therapist that has a license, they already have all the knowledge they need. Do you know how many classes I took on gait training, gait analysis, biomechanics, okay, neuromuscular reeducation? Do you guys know how much classwork we take in physical therapy school for this, the knowledge is all in there for us. Developmental gait patterns, even for pediatrics, guys. Okay. What scares PTs off is the prosthetic side of it. Like they see this very expensive piece of equipment and they get spooked. I get it because I used to be one of those PTs. I saw my first prosthesis and it was a simple below the knee prosthesis, not a big, and I'm sitting there going, good heavens, I hope my patient knows how to put that thing on. Okay. I get it. That's where I started. We all started there somewhere. Okay. But guys, thank you for scanning the code. Come on, guys, let's get some more scans on those codes. Let's show College Park some love. They've been one of my longest running sponsors. I want to see some more scans on there. Okay. So Mark, going back to your question. Yes. And again, in my current practice right now, right? In my current practice, my setting, 9 out of my 10 patients that come see me will say, they'll come to me on a walker or a cane, and they'll say, yeah, I think I did get some physical therapy, and they just kind of walked me around with a walker, and they said that was about it. Okay, so Mark, you're absolutely right. And I will hold my profession's feet to the fire in that regard. We do need more of that. Okay. And the group of therapists behind us that are behind the scenes that I mentioned, we're working on that in terms of training, in terms of establishing a residency program at one of the top hospitals in the nation. And I'm so excited about that. Okay. Another thing, and this is where I'm reaching out to my prosthetist. Mark, I hope you're still on board listening. I hope you're still on board. Mark, are you still there? Or did I scare you off? Did I scare you off, Mark? One of the things that I tell prosthetists when they tell me, I want to work with a physical therapist, but there's nobody around. Okay. This is where the prosthetist can be the mentor and the physical therapist. And it goes both ways, right? When I hear about that from a prosthetist, I'll say to them, and usually what they'll tell me is, yeah, there's this physical therapist out in my community. They don't really have any experience, but I think they want to help. Work with them. Okay. Even after all the years I've been practicing and all the experience I have, I heavily rely upon the prosthetists that are working with my patients. I heavily rely upon them and their expertise, right? I rely heavily upon them to troubleshoot prosthetics, to troubleshoot the alignment. Okay. So in terms of where the prosthetist can reach out and say, you know what, let's work together. And I've seen this. I've seen prosthetists go to the physical therapy clinic the same way that as a physical therapist, I go to the prosthetist clinic and start with the simple, right? Just start with simple gait mechanics and the training. Okay. Mark says most PTs don't take patients out of their comfort zone. Correct. You're right. And most people try things that they think they can't do. Make people try things that they think they can do. You're absolutely right, Mark. And like I said, they come to my clinic with a walker and they were told by the physical therapist, yeah, that's how you're going to stay safe. Oh, dear heavens. And they were walking prior to their amputation. Guys. So for my prosthetist, and here's the other hack that I will tell you. Look for the physical therapist in your community that has their own private practice, that they are practicing on their own. Okay. We are starting to see a small but growing number of physical therapists like myself that we are breaking away from insurance-based practice, and we run mobile practices, meaning we can go to the prosthetist clinic or we can go to the patient's home and work with them there. Okay. We work with our patients one-on-one. They may not necessarily have amputee experience, but they're going to be hungry to learn and they're going to be hungry to serve their patients. Okay. I've had many of those colleagues call me from around the United States. And they're like, Cosi, I got this amputee patient. I don't know what to do. And I walk them through it. And I tell them what questions to ask the prosthetist. And they learn and they figure it out and they get some great outcomes, guys. As physical therapists, and again, this is where the profession comes in. As physical therapists, when we graduate from school, we have that license in our hand, we have the knowledge we need to treat the dysfunction of the gait cycle, right? Gross motor function. Okay. We have that ability to do that. And then as the person becomes more comfortable with the prosthesis, you're going to see them and they need to start taking the CEU courses, right? Good seeing you too, Mark, and I appreciate your input. By the way, guys, Mark is one of those prosthetists who is awesome. Awesome. Had the chance to work with Mark. Mark, I think you're retired now. I think you've retired, but I am glad to see you here watching the show, and I appreciate that very much. Okay. Let's see. Michael says, he's the physical therapist, says a lot of patients need hip adduction and other 3 muscles and need exercise. Yeah. Guys, when I was joking around, when I say that I don't do it, of course we do exercises to strengthen the muscles of, of what's going on, right? We strengthen the muscles, we strengthen the person head to toe, but it's how we do the strengthening and then how we teach the muscles to work together. Neuromuscular reeducation, right? Big component there. Let's see. Josh says what's pretty sad is just now amputees are allowed to go back 3 to 5 days after either temp or definitive. Getting a temp or definitive is taken long is nuts. Duh, we better. Yeah. Not sure. Okay. Chuck is here. Oh, Chuck is here. Michael says I did quad sets with an AK and he was so fatigued. Yeah. Yeah. First of all, the quads are, not a lot of them are there, right? Because they're going to be cut. So they're going to fatigue very quickly. And again, yeah, you've had a massive, massive traumatic injury to that muscle. So the brain is not going to want to recruit those motor units very efficiently. Let's see. Mark says, while I realize insurance is important for anyone that's had an amputation, the cost of PT is something I paid for out of pocket when I needed more the insurance covered. Guys, and, and he says, PT is very affordable and completely worth skipping the Starbucks, et cetera, to afford to go. Yes. And guys, I recognize that our healthcare system, we got a lot of problems, right? We have a lot of problems with our healthcare system with insurance. Some of the co-pays that I've heard some of my patients tell me that they're paying upwards of $50 to $100 copay for their physical therapy, right? And that was kind of one of my talking points to some patients who come and see me. I go, for almost what you're paying in copays, you could be paying my fee for an hour one-on-one, full one-on-one. Okay. And it is an investment in your health. And guys, I get it. It is not easy. I've had to pay, cancer is real expensive to treat. Let me tell you, cancer, one of the top most expensive things to treat. Spinal cord injury and burn trauma are the next ones there. Okay. Super expensive to treat. So I understand out-of-pocket costs, having to make sacrifices, like Mark said, having to skip the Starbucks or more, right, to make those ends meet. Okay. It is an investment in your health. It is an investment in your health. And some of you have insurance. And again, insurance is not the devil. Okay. It's there for a reason. And my insurance came through for me on several things, did not come through on other things, right? But it's something that we get to work with. Okay. So again, don't give up the fight. I guess that's my war cry right there. What is interesting, GI Jane says, what is the issue with the CPOs and how is it any skin off their noses? No. And again, guys, I'm not here to demonize the prosthetists or demonize the physical therapists, healthcare system, not too crazy about them. But it's to say there's a lot of misinformation out there. There's a lot of and ignorance out there on both sides. Okay. PTs thinking that they don't have the knowledge to work with amputee care and that they're afraid to do it. No, not true. I feel like taking them and saying, no, not true. And then the prosthetist thinking, the patient doesn't really need that. It's just some strengthening exercise. No, much, much more than that. Much, much more than that. Let's see. Mary says, in 1983, I had PT. The Army Hospital in Hawaii even had an amputee clinic. Yes. And Mary, here's what kills me, man. Here's what kills me. Prior to 1997, before you had surgery, okay, and this includes amputee care, guys. This is where I'm just like, what the hey happened? Prior to 1997, getting physical therapy before a surgery, whether it was a hip replacement, ACL repair, rotator cuff repair, amputation, was the norm. It was standard of care. And the physical therapist knew how to deal with it, right? If you ever look at that list of initials behind a person's name, right? Here's the basic interpretation. DPT means they're young. MSPT means they're not so young. PT, that means they're badasses, okay? If it just says PT, right? No other initials there. That means they got their physical therapy license and degree back when it was just a bachelor's. And this was pre-1993, I think, somewhere around there, where your education involved getting a bachelor's degree and you could apply and you were a licensed physical therapist. That generation of PTs prior to that, they all knew how to work with amputees. Okay? You could shove them into any patient room, and regardless of that patient's diagnosis, they knew how to treat the patient. And then somewhere along the lines, guys, right after the bachelors became the masters, I'm the masters generation. We're a very small group of people. That's what I'm saying. You can tell our ages by the initials behind our name, right? The masters group, we still got that kind of an education, right? And those of us who are nerds like me, we saw the previous generation and I said, ooh, I want to be like them. So I want to make sure I go to the hospitals and do all the different rotations and really learn how to work with all types of patients, right? The DPT, the new crop coming out, they're not getting that. They're not getting that. And some of the DPTs are folks like me who transitioned and went back and got their DPT, their doctors in physical therapy. Okay. I chose not to. Several reasons. Anyways, but yes. So Mary, in 1983, you would have gotten a physical therapist who knew what they were doing. Unfortunately, that generation of physical therapists have retired or they're this close to retirement. Okay. Those were my mentors, right? Of my mentors, I'm trying to think of the four main mentors that I had, 4 men and physical therapists who shaped me in the PT I am today. One of them unfortunately passed away. 2 of them have long since retired. They've retired years ago. And then the other one, I know he's getting probably close to retirement himself. So yeah. Right? All right. I will tell you a little bit here. Let's keep reading some of these questions. So Jane, excellent question. Jane's asking, whose job is it to talk about needing physical therapy? Hospital staff, CPOs, etc. In a nutshell, everyone. Okay. It is the surgeon's job. It is the prosthetist's job. It is the nurse's job. It is the physical therapist's job. And it's the patient's job. Everybody should be recommending it. The same way that when your nurse comes in, she might recommend, and when you're in the hospital, she might recommend, it's time for your pain medication. Would you like to have some pain medication? Or the nurse might recommend, it's good for you to maybe get out of the bed and into the chair. Or as a physical therapist, I might look at my patient who is in tears and I might say to them, maybe it's time to get some support, some mental health support. Okay. We're all supposed to be making these recommendations, guys. And it can start with you. Like I said, you guys are your best advocate. You guys are your best advocate. And I think probably the best emails I get in the 8 years that I've been on the show, and guys, I save every email. I save every email that I get from you guys. The best emails that I get are the ones that tell me, Cosi, I watched your show and I learned that I have the right to try more than one prosthetic foot before I decide on a prosthetic foot. Or I learned that I can ask the surgeon these questions about my surgery before I have the surgery and commit to having that surgery done. Or I've learned that I can talk to more than one prosthetist and get a second opinion if I feel like one prosthetist is not cutting it for me. Or I know that my current physical therapist is not meeting my needs and it's time to look for someone who is. Those are the best emails right there. Okay. So for those of you who are watching this show, I'm going to put the onus on you, okay, to be on your team and to advocate for yourselves for this, right? All right. We got Flying Flamingo Jade. That's a cool name. Jumping on board into Instagram. All right, guys, let's see. And if you have any other physical issues in addition to the amputation, PT is even more important and necessary. Yes. Yes, guys. And this is something that I talk to my PT students and my young PTs, the ones who are curious about amputee care. And I go, guys, amputees are not just amputees, right? These are people who have had strokes, folks who have had joint replacement, folks who played football in their youth, and they have a whole slew of orthopedic injuries that they're bringing into the equation. These are people who have been in a horrific accident, right? So they had other injuries as well as the amputation. These are people who have autoimmune disorders. Okay. For me, guys, one of the things from a clinical standpoint, a clinical and academic standpoint that I enjoy working with amputees is that I get to pull upon everything I've learned in physical therapy. I'm pulling from all those different skills to treat my patient as a whole. And a lot of times, and I've had this conversation with some of you, a lot of times your amputation is the least of your problems, that you've got other things going on that are more dire that need to be addressed. And that my goal as a physical therapist is to make your amputation the least of your problems. Like, I want you using that prosthesis and getting around smoothly and efficiently so that you're not thinking about the amputation and you can focus on some of the other stuff you have to focus on, right? Jerry Ann says, I'm a bilateral amputee and had one leg amputated in January, the other one in April. And they said, you don't need rehab because I could do most things and all rehabs were full. So I went to PT. And the inpatient rehab, Jerry Ann again, and this is me playing my quarterback, the inpatient rehab is a place to basically get yourself functionally independent, right? Again, years and years and years ago, we're talking 60s, 70s, 80s, maybe even the early 90s. Okay, you went to inpatient rehab and you stayed there for months until you came out using your prosthesis. Doesn't work like that anymore. Right now, inpatient rehab is basically the bridge between the hospital and the home so that you can become functional and independent, meaning you can get out of bed by yourself, you can get to the bathroom by yourself, you can feed yourself, and maybe do a little bit of walking with the walker, right? And because it's going to take 6 weeks before you can get your prosthesis issued, okay? But yes, physical therapy afterwards for outpatient to continue that, absolutely necessary. Absolutely necessary. Okay. Stacy says, I definitely could have used the physical therapy before Oprah. I think they thought 17 years of PT before the amputation was enough, and it made me feel like we had failed even more with the amputation. It was probably part of my emotional and mental landslide before Oprah. Yeah. And Stacy, again, like my patients, when they become my patients, whether they see me once because they're only coming from out of state and they can only come see me once, I'm like, you're my patients for life. Okay. I will check up on you. And I want you checking in back with me. Check in with me. If you're living life and you are, what's that expression? Living your best life, then just give me a call every 6 months to a year, once or twice a year. Just give me a call and say, hey, this is how I'm doing. Awesome. Be on your way. Keep going. But knowing that I am there as your physical therapist in case you run into any issues. Yeah. Chuck says, I used to walk 5+ miles a day, 4 years of being an above the knee, and I still can't figure out how to get my balance back to get rid of my forearm crutches. And now my hands hurt shooting pain up my arms. This is the stuff that makes me just sad, right? That's the part that just makes me go, And again, guys, there's complications in the history. There's things that have happened in those years, It's one of those things where I look at someone like Chuck and I go, well, can he potentially go back to walking 5 miles a day? Don't know. But it's something that it's like, man, that'd certainly be worth a try to see where are you at? What is preventing you from walking independently without those forearm crutches? Like, what's going on there? Let's dig in a little bit. That's the physical therapist job, guys. That's our job to do. Yeah. We need the prosthetists to give us the platform with which you can move, with the beautiful legs that they construct. And I will never, never presume to be able to do anything that a prosthetist does, whether it's a simple alignment or creating a socket. No. I make my recommendations in terms of prosthetic componentry choices, but ultimately the prosthetist is the expert on constructing a beautiful prosthesis. The physical therapist is the expert on learning how to use it. Right? How do I show how many of us scanned? I have a fun little thing here and it shows how many people scanned. And I see that a lot of you scanned, 16 of you scanned. And I really, really appreciate that. But guys, guess what? It's time for another one. And again, I talk a lot about my sponsors, guys, and I'm going to continue to show them love and show them gratitude. And I'm glad that you guys are here with me for this. All right, guys. So we have some questions coming in from Integrum. I sent you that text message on bonded matrix, right? So traditional sockets can be very frustrating, but with the Oprah implant system, you get that direct skeletal attachment for more comfort, stability, and freedom. And the bonded matrix is what makes it possible. Only with Oprah and only with Integrum. So guys, scan that QR code. You've been hearing me talk a lot about bonded matrix. It is unique to the Oprah implant system, the only FDA approved system for osseointegration in the United States for above the knee amputees. So guys, scan, baby, scan. So even if you're not necessarily a candidate for osseointegration, even if it's not something that you would ever consider, it's good to learn about these things. And worst case scenario, guys, again, Showing support for the show means you show support for the sponsors, and a simple QR code click will help with that. So guys, thank you very much for that. Let's get to one of these questions. I know I've been going off the rails tonight with my soapbox, and I appreciate you guys letting me have my moment. No, so Harsh, I cannot show you guys the number of scans. Like there's no way for me to show that, but I have like a little like icon here, and it flashes whenever someone scans, and then it gives me a number. It's kind of cool, but it is a behind the scenes. It's a behind the scenes thing. Maybe I'll take a screenshot. You know what? Let me take a screenshot. I'm going to take my screenshot and I'm going to show you guys tomorrow. So look for my post on my stories. Okay. I will post that picture so you guys can see what I'm looking at from the behind the scenes here. Richard says the VA here has been very willing to send me to outsource PT. And that's, don't get me started. We have a fantastic VA here. It's an amazing VA hospital. Lots of red tape, but let's see. 19 Pop has Pop 19 says, PT versus OT, I've learned from both. Sometimes it is nothing. Sometimes it's a small part of everything. Yeah. Yeah. And guys, when I talk about PT, I really should also be saying PT, OT, PT, OT. OT is the peanut butter to our jelly, right? Peanut butter to our jelly. Their role does become different in the outpatient setting. Okay. And in the outpatient setting, if it's an upper extremity amputee, then OT is going to play a much, much bigger role. If it's a lower extremity amputation, then this is where the physical therapist takes more of the role there. But certainly in those days in the hospital, in the rehab setting, in the inpatient rehab setting, yeah, OT, incredibly important, incredibly important. Yes. So AJ, I believe that was one of your questions. So let me get over here. That was a question. Hang on. Wait for it. Wait for it. Wait for it. Good heavens. It was here. Okay. So Andre was asking, he was referring to the bonded matrix video, okay, that I sent. So again, guys, bonded matrix is the manner in which the surgeon manipulates the soft tissue and creates the opening, okay, for osseointegration, right? I just realized I highlighted that. Sorry, guys. Okay. So again, with bonded matrix, with the osseointegration, right, the implant is coming out and then the prosthesis attaches to, there's another component here called the axor 2, and it attaches directly to this implant, okay? So there's no socket. How it exits the bone, so it's implanted in the bone, and then the skin is surgically attached right here to this part of the bone. And it's a procedure. I don't have my pictures with me. I need to bring my pictures next time. But basically it attaches here and it creates the little opening, the little aperture. Okay. So with the Oprah implant system, this particular one, okay, it makes a very nice, tight seal around that implant. It's not attached to the implant. Let me just clarify that. It attaches to the bone. Okay. So when it comes to your question, Andre, where you asked if the bonded matrix system would work on an open wound, okay, the answer is no, because the purpose of the bonded matrix is to attach it to the bone, to attach the skin to the bone and how it arranges the soft tissue. When you have an open wound, okay, if they're doing any kind of a surgery on that wound, they're either going to do a debridement, meaning they're going to clean out the dead tissue, the necrotic tissue, to allow the clean tissue to heal in properly. Okay. If it is a severe, severe wound, one that goes all the way down to the bone, okay, what they're going to do is they're probably going to do some form of a graft. Okay, that's typically what happens is if it's all the way down to the bone, that severe wound, then they do a graft. It might be a full thickness skin graft or it may be a split thickness skin graft. Okay, but they're not going to attach the skin to the bone. Does that make sense? And that's what the bonded matrix is doing. Does that make sense? Now, AJ, I will say this on pesky open wounds. That's another one of my top 10 soapboxes here, right? On those open, pesky, chronic wounds, this is where you need the care of a wound care team. Okay. And this is another thing I run into a lot. And again, this will get me all hot and bothered as well. I have had a lot of patients who come into me and they have seeping wounds on their residual limb. They're still wearing their prosthetic devices. Their doctors, their prosthetists, and sometimes even the physical therapist will tell them it's okay to wear their prosthesis. It's not. Okay. So if you have an open wound, especially one that's chronic, meaning it's not been healing, okay, first thing you need to do is take the prosthesis off. Second thing you need to do is you need to go get an appointment with a wound care team. Thankfully, those are a lot easier to find than an amputee PT specialist. Okay. You can literally, and I've done this for some of my viewers where they're just like, Cosi, I have this wound. It's not healing. My internal medicine doctor just keeps putting the same stuff on it. It's not healing. And I'll say, where do you live? And I'll go, okay, wound care area near Poughkeepsie, New York. Okay. And we'll get a nice list right there. All right. So AJ, if this is something that is a problem for you, if you have an open wound that is not healing, you need to go see a wound care team, preferably one that is headed by a general surgeon or plastic surgeon. They're usually ones who will head up these wound care teams. Okay. Brian asks, does copay mean per session? Yeah. Typically, your copay is done per session. And I've had some people who come into me and they say, I've had copays as high as $50 to $100 per physical therapy session. Hey there, Stephen. Thanks for coming in. Better late than never, man. Good to have you here. Good to have you here. Sorry, guys, if I'm skipping some of your comments. Kim says, those of us on Medicare get much less in terms of proper healthcare. Yes and no, Kim. I mean, I'll be honest with you. And again, guys, my knowledge of insurance is like really like, because I haven't worked with it and I haven't had to work with it, and I don't regret that for one instant. Medicare, I find, actually provides some of the better care. And a lot of the physical therapists that work with Medicare patients, they can still kind of work with them one-on-one and they have to. I find the Medicaid patients, they're the ones who get shortchanged a lot. I find certain private insurances that there's definitely some that are better than others. And it does seem to be a you get what you pay for kind of thing. I remember when my father retired and he went into retirement and he had the choice of, through the military, he had the choice between two insurances, one that was very expensive and one that was not as expensive. And I remember saying to my dad, I was like, Dad, pay the extra money. And he was a healthy man, very, very healthy man. And I'm so glad that he listened to my advice, because eventually he did get very, very sick and he needed a lot of care. And the better insurance that he paid for, the premium insurance, it did its job. It did its job. And obviously everyone has to do what they can do according to the budget that they have. But yeah, it is a thing. It is a thing. All right. Ham Sandwich is like, dadgummit, I lost track of time tonight and I'm way late. What did I miss? Son, you missed a lot. You missed a lot. You're going to want to go back and listen to it. And that's why God created the replay. That's why God created the replay. We've been talking a lot about one of my favorite soapboxes on the need for physical therapy, Let's see. G.I. Jane is saying, I am laying in bed from stage 2 surgery. Oh, good. You had it done, G.I. Jane. All right, girl, you got to behave. You've got to behave. Follow what the physical therapist tells you to do. Do not push it. I know. I'm talking to you, G.I. Jane. I'm talking to you, Susan. Don't push it. You behave yourself. You do the recovery the way you're supposed to be doing. Yeah, I'm going to be watching you. I'm going to be keeping an eye on you. I'm going to be keeping an eye on you because I know how long you've waited, and I know that you have worked really hard to get to this point, G.I. Jane. So I want you to have the absolutely best outcome possible. Absolutely best outcome possible. Guys. Okay. Coming up on April 1st, and this is not an April Fool's joke. I've got Neuros Medical coming on board. Okay. They are the makers of the Altius system. It is designed for the treatment of chronic phantom limb pain or residual limb pain in adults after amputation. Okay. Guys, we talk a lot about pain on this show. Okay. you need to know about all of your options and everything that is available to you. This is another option that we will be talking about extensively on April 1st. Guys, the show on April 1st, as the kids would say, it's going to be lit. I can just hear my kids groaning in the other room. They're like, Mom, you're not that cool. It's going to be lit. Okay. We're not just talking about another option for chronic amputee pain. We're going to be doing a deep dive into the nature of pain. And yeah, it might be a little painful, bad pun intended. We're going to do a deep dive. I've never done a show like this, guys. In the 8 years I've been doing my live show, I have never done a show like this, okay, where we're going to talk about the nitty-gritty of why your body interprets pain. How does that work? And you all know me. The more educated you can become on the whys behind your body and what it's doing and why it's doing it, the better chance you have at being able to understand and then maybe find some answers for it. So guys, April 1st, y'all don't want to miss that show. That's going to be a great show. Thank you for those of you who are clicking my QR codes right now. We're at 29, guys. I always love to see like, how high can we go? Let's show these folks the support for their business and for their supporting the Cosi Talk show as well. All right, back to the chat section. Ham sandwich. Oh, Bill. Oh, apparently Bill says you missed the $1 million drawing. Clearinghouse sweepstakes. Y'all remember that? Y'all remember that? Bill's like purple. His face is purple crying. Bill, what are you crying about? I know I said a lot of stuff to make people cry tonight. I'm just wondering which one made you cry tonight. David says, since this is my first time here, have you talked about what type of AK socket has given the best stability and what clinic does that? David, that is an incredibly specific question. Well, first of all, welcome. Thank you for being on the show. I appreciate you being on the show. And actually, this feeds into one of my other questions. So thank you for that segue. I would like to say we planned this, but we didn't plan this. All right. So the question about the socket was, Cindy was saying, okay, so Cindy was asking to give my thoughts on the Slingshot Bionic socket. She says it looks great. I hope to be getting one soon. I had surgery last week to remove rod and residual lid before it popped out on its own. Okay. So the Slingshot Bionic socket. So I first heard about this one at the Amputee Coalition National Conference in Vegas. Woohoo! Great time. They were kind of like the hot buzzword in the conference, the Slingshot Bionic socket. Okay. So it's an adjustable socket. And guys, I don't have any kind of partnership with Slingshot. This is just me gathering information from what I've been hearing and so y'all need to go do your homework on this one. Okay. I'm going to keep doing my homework, but y'all need to go do your homework. So in the past 10 years, we've seen more adjustable socket options on the market. The big hitters are the Revo Fit from Click Medical, and they were longtime sponsors and they're still supporters and partners of the show. Okay. We had Limb Innovations. To my knowledge, they don't exist anymore. Then we had the Martin Bionics socketless socket come out onto the scene. My understanding, and again, if anybody can correct me on this, please double check me on this one. I need to go double check this information. From what I was told, someone from Martin Bionics created Slingshot socket. Okay. Because I remember I looked at the Slingshot socket and I looked at the Martin Bionics socket and I go, they almost look like they're a little related. Okay. So yeah, I think my understanding is that someone from the Martin Bionics team went and created Slingshot socket. So it is, an adjustable socket system. I actually had my very first patient who came with the socket last week to come and see me. So again, and I can only tell you based on the experience of this one treatment session, right? The socket seemed to be comfortable. The patient, I worked with this patient. This was an out-of-state patient, and I worked with him for 3 hours. Bless his heart. Bless his heart. He put up with me for 3 hours. And the socket was comfortable and it stayed as a comfortable fit. Okay. That to me is a good thing because when I was working with a patient for 3 hours, as you can imagine, we need that socket to be comfortable, especially as an out-of-state patient. I do have some questions about the alignment. There were certain alignment things that had been done with the socket that I'm like, why would they do that? And again, those are just questions that I just need to talk to someone from the Slingshot team and be like, why this? Like, I don't understand this. Please clarify this for me. So I still have a lot of questions about it. I would say to you guys, and again, I say this about everything that comes out on the market, whether it's a prosthetic device, whether it's a newest surgical technique, whether it's a new socket componentry. A lot of people have a hammer, right? A hammer, brand new hammer, and everything looks like a nail, right? I would encourage you, please talk to your prosthetist first. Okay. Before you go, because my understanding is, I don't know if it's covered by insurance. I don't know, guys. But you do have to travel to the clinic. Okay. So you're going out of town for this thing. And then you need to have your prosthetist on board. That would be my biggest advice when it comes to the adjustable slingshot socket and the Martin Bionic socket. Any socket that's not made by your prosthetist there. Just be sure that they are on board with it and that they are communicating with the slingshot team. That would be my recommendation, right? And then ask your prosthetist, like, do you think I'm a candidate for adjustable socket technology? And that's whether you're getting the Revo Fit, the Martin Bionics, the slingshot. Talk to them about this. Okay. What concerned me a little bit at the conference is I heard a lot of people getting really excited about it. And they're like, oh my gosh, I'm going to go home and I'm going to get it. And I would ask them, well, no, my socket's fine. So why do you feel the need to go change it? Again, it's the excitement about the novelty of something new, right? I get that. Totally get that. I would just say, take a minute, slow the roll, talk to your prosthetist. And again, I want to learn more because it sounds like this one is coming out on the market a lot. So yeah, I got to do my own homework. Yeah. Let's see. Sherry says, I spent 5 days in the hospital. I woke up in my back. The pain was the worst ever. I couldn't move. Then I started struggling to breathe. And the doctor said I had developed hypoxia, respiratory failure. Brought on by atelectasis in the setting of my back pain. My back found multiple levels of disc herniation with severe canal stenosis. Wow. Okay. So now I'm in need of major spinal surgery. I'm now on oxygen. As when they attempted the 6-minute walk, my oxygen levels dropped massively. So overwhelmed, but they did give me physical therapy starting at home. Unfortunately, a lot of different meds to help with the pain. I lost so much as I was walking every day, now very slow and exhausted, but I won't give up. Good. Sherry, that sounds like holy crud. That's a lot for you that is a lot. That is a lot. But again, I'm rooting for you, girl. And I want you to keep me posted. Let me put this is the part where I put my email address down. Okay. So for those of you who are new to the show, this show is for you. It's for you as amputees, the prosthetists, physical therapists, the clinicians who serve them, the family members, and the caregivers. Any questions that you may have, send it to my email. My email's right there. So it's any questions about your recovery, any questions you maybe didn't want to post on the show, any overly constructive or flattering comments that you want to put on there, go ahead and send that to me as well. Sherry, in your case, I'd love to hear updates on you, darling. Love to hear updates. And yes, keep working with that physical therapist because you were there once and you will be able to get back there again after that surgery. And I'm glad that they had that physical therapist there. Hey there, Gilda Madrina. Thanks for joining on board. All right. Oh, my pleasure, G.I. Jane. It's a pleasure having you on this show. And I love the emails that you've been sending. Love the emails. Let's see. Oh, if I use OBS for my streams? No, I am not that fancy, ham sandwich. I would like to use OBS. And I'd love to do some fun stuff. But yeah, I have to wait to win the lottery and then I can get my own production team because that would be phenomenal. I would love to turn the tech over to a production team. I would love nothing more than to turn the tech over to the production team. Y'all don't know. I feel like a disc jockey. Like I feel like a DJ here. I've got so many things open here running this show. It's kind of funny. Pop 19 is asking about Senor Pickles. Senor Pepino is hanging around somewhere. He's big. He's going through this typical cat stage though. Like I'll pick him up, I'll try to snuggle and have my way with him and he wants nothing to do with me. He loves my older teenage son. He loves my older teenage son right now. I'm hoping it's a phase because I'm like, dude, I'm the one who rescued you from becoming a ketchup splot on the highway. This is my cat, by the way, guys. That's who we're referring to. But we'll see. All right, Ham Sandwich is asking, about to start casting our new socket next week because the current socket is really hurting. Should I work from home tomorrow to take it easy or go in the office to get up and walking but hurt? Ugh. Ham Sandwich, I'm always going to tell you, if you're able to not be in pain, that's the route I would take because what I would hate for to happen is for you to have some kind of a skin breakdown. And again, this is where having the walker or the crutches could be perhaps good. You keep those in your closet and use them for cases like this. So in case if you do have to go into work. But yeah, I'm always going to tell someone, let's not put ourselves in pain. let's not put ourselves in pain. It just, let's see. Jane, what were you laughing about? Okay, you're being good. Okay, good. That's what you were laughing about. So Val says that Chuck loves his slingshot socket and got it last week. And again, guys, I want to keep hearing more feedback from you. That's how a lot of times I learn about some of the newer prosthetic things out there, innovations out there from you guys, because you guys are the ones bringing it to me saying, hey, Cosi, what do you think about this? And I'll be like, let me get back to you. And let me go run and find out more information on it. So yes, so Val is saying that Jay created both the sockets. Okay. Oklahoma City, not covered yet. Okay, so it's not covered by insurance yet. Both types are covered by insurance. Okay, so we're getting some conflict there. So again, these are things that you guys need to go do some research, and I'm going to do my research as well. Let's see. David says, if you go to the website for Slingshot, they sell direct to home and have installation videos on the website on how to put it together. I think it costs $3,000 to $5,000 if memory does not fail me. Okay. Thank you, Sherry. And I really mean it, guys. Whenever you guys send me emails about questions or situations that you're in, and I always end my email by saying, please keep me posted. I am sincere when I say that. I like to hear the updates on how you're doing, whether it's good or not so good. Okay. Let's see. Oh, it's my pleasure, Harsh. My pleasure. Guys, I have to tell you a little bit of a funny story. And it was like a sheepish moment about that reel I posted. It was like I had to eat a big old piece of humble pie. Pastor David, I think you're going to get a kick out of this one. So I post the reel and I'm feeling sassy that day. And I'm like, I'm going to post the reel. Let's ruffle some feathers, right? So sure enough, a prosthetist, at least who I think is a prosthetist, and this was Saturday morning, posts very nicely, posts a comment. And, you know, in the comment, he says, yes, in a perfect world, all of our patients would be getting physical therapy, but sometimes our patients have limitations. And the person who wrote that comment wrote it very nicely, and I'm sitting there going, well, no, I disagree. I think every person should have physical therapy. It shouldn't be just nice. And I go into my diatribe, right? So we're commenting back and forth, and I look up this person, and it's a clinic in Dubai. And I post the last comment, and, you know, the person had been replying to my comment pretty on time. And then I'm like, boy, this person did I get the last word here? I'm like, what just happened here? And then I turn on the news. Guys, I felt this big. I was like, oh, dear heavens. Here I am having a silly bickering on Instagram, and this poor man's country, right, is in a lot of danger. So I immediately private messaged him and I said, hey, I just saw the news. I hope you and your family are safe. And he responded very kindly. Thankfully, he was very safe, and, you know, his family's in Dubai, and we had a very lovely conversation. But it was a very sheepish moment. I'll tell you what, it was that moment where you just go, oh, geez. Do you guys remember that Looney Tunes, the old Looney Tunes cartoon? And I can't remember what two characters it was that they were after each other, like one was hunting the other, and then they go and they clock out, like they punch the card and they clock out, and then they're buddies and they're good, like, hey man, all right, heading into work, yeah, heading into. I felt like that was that moment right there with that particular clinic. And again, I would, you know, the person on the other end of that account was very gracious. Yeah, but so just one of those moments. All right. Ham Center says, I'm getting skin breakdown and swelling inside my butt cheek from sitting on the ischial containment where it pinches. Yeah, it's time to not use that socket right now then. No. If we get skin breakdown, you know the rules. Ham sandwich. No wearing the prosthesis. Pop19 says, Pickles is a panther in training. He looks like it too. He's a pretty one. I've always had ugly cats. Growing up, I had ugly cats. It was like the tortoise shell cats. Loved them. But man, those are some ugly cats. This one's a pretty one. He's all black. He's got a nice shiny black coat and nice big thick tail. He's got a little white tuxedo and little white paws. He's real cute. All right, let's see. Whoo, guys, it is 10 o'clock. Y'all know it's like way past my bedtime. It is way past my bedtime. But guys, before we go, we cannot go without showing some love to my boy Sleeve Saver, to Bill Hatton. Okay, guys, The Vital Fit skincare is back, and it's available under the Sleeve Saver label. Okay. It's going to keep your skin soft, protected, and ready for prosthetic life. Y'all know how important skin health is to me when it comes to using the prosthesis. Guys, let's get these numbers up. Let's show Bill some love. He came on the show a few weeks ago, probably one of the most humble and sincere people out there in the O&P industry. He is a bilateral below the knee amputee himself. Everything that he does is done and designed to make your life easier as an amputee. And he has some of the most amazing ideas, simple solutions for everyday life. Guys, I'm going to stay on here until we see a few more clicks on that QR code. Thank you guys to those of you who are clicking on there. I greatly, greatly appreciate it. Instagram, how you guys doing over there? We got Michelle on board as well, and Sarah on board as well. All right, let's see what we else. 9 in South Dakota. 9 in South Dakota. Oh, it's 9 in South Dakota. Right. That's right. You guys are an hour. I think you're on Central Time, I think. Let's see. Ralph and Sam, Sheepdog and the Coyote. Thank you. Ralph and Sam, Pop 19. It was a Ralph and Sam moment. Like we were like this on the Instagram reel and in the comment section. And then I see the news of like Iran. And then I hear that Dubai's getting some of that as well. And I go, okay, time to clock out. Time to clock out. You okay, buddy? You good? You good? Yeah. Let's see. Blue Diva is asking, is Sleeve Saver available in the UK yet, as it is such a great idea? Oh my gosh, girl, that's a great question. I do not know the answer to that question. I don't know if Bill is still. Bill, are you still on here? Bill, are you still on here, love? Let's give him a minute and let's see if he can answer that question for us. I don't know, Blue Diva. I don't know the answer to that. I should know the answer to that. Jeffrey's saying, oh, me too. Okay, so Jeffrey, haven't seen you in a little while. I do like seeing you. Makes me smile. Timothy Plaster, welcome on board as well. All right. You guys are awesome. Thank you for those QR codes, scans. I appreciate that, guys, very, very much. Thank you, thank you, thank you, thank you. Oh, there we go, guys. All right, Blue Diva. I am writing it down that I need to ask Bill if they ship to the UK. Blue Diva, I'm going to put my address. Oh, you're here. Bill, can you answer for us, please? Is the Sleeve Saver available for shipping to the UK yet? I don't know the answer to that. I'm sorry. I should know that. Especially for BKs as they burn through liners so fast, and the wait time on the NHS for the new liner can be weeks. Yes, you're absolutely right. You're absolutely right, Blue Diva. Blue Diva, here's what I want you to do. Here's what I want you to do, girlfriend. I think you're a lady. Are you a lady? Sorry. I'm assuming you were a lady because of the diva part. Bill saying we are in conversations with the distributor. All right, Blue Diva, I have a homework assignment for you. And I have mom brain sometimes, so if you don't do this, I want you to please email me at cosi@cositalks.com. Do that for me, please. Ortho Europe and Obcare. Blue Diva, okay? I want you to email me. Email me like right now or tomorrow morning first thing. Or wait, you're a girly. Okay. All right, love. Email me. I know it's really late. Girl, it's really late where you're at right now. It's like 4 a.m. Night out. Okay. Email me now and just say, Cosi, you told me to email you. And then send me your name and I'm going to contact you tomorrow. Got it? We good? Yes? Okay, good. All right. With that, folks, I can now put on my jammies and go to bed. Guys, as always, thank you for letting me be a part of your lives this evening. Tonight was an intense show. I do want to say that I could not do the work that I do without the support of my sponsors on the show, and also the support of the prosthetists and other physical therapists in the community, and for those of you guys who are my amputees. So guys, thank you. We will see you guys next week, same bat time.